So Holly, welcome, and thanks for coming to sit in for an interview.
Well, thank you very much for this opportunity. I sincerely appreciate it.
Well, I am excited because, and I think people who be tuning in for this would be excited because, you're not one of our clinicians or physicians. You're certainly someone who is one of our important practitioners, but you're not a physician or one of our research scientists who've done a lot of these interviews. But you're someone who's directly helping patients in a very positive way. And certainly we want to make sure that even though the goal for a lot of the things we support through the foundation, a lot of the work that's going on in the department is to try to solve problems, fix problems for people with vision loss. We're not there yet for many things, and a lot of people need help, and that's what as I understand it, you do, right? In occupational therapy, is you're gonna help people improve their lives. So so tell me, this is a lot of training, a lot of education, a lot of very focused training. Whatever along your path made you think, I want to be an occupational therapist, and then I'm going to specialize in helping people with low vision?
Well, that's a wonderful question, Lonnie. And the first thing I want to mention is a lot of times occupational therapy is maybe not best understood. And I think the one thing that I want to explain is occupational therapy is actually the art and science of living. And when we think about the word occupation, we think about everyday activities that individuals need and or want are expected to do in families, at work, in communities, to occupy time and bring meaning and purpose to their life. And when we think about occupational therapy, the occupation itself is very curative, and we find that it's very, very important to understand that. So the question about how I got interested, it's very kind of interesting. I actually grew up in the Midwest. I was born in Iowa, grew up near Chicago, and at that time, I was very involved in Explorer Scouting. And we went to the John Hines, the Hines VA hospital in the city, and we were exploring different avenues of careers, and we stopped upon the occupational therapy department. And this was at a time during the Vietnam War where they were bringing the soldiers back and doing all these great things with occupations, with crafting, with great things to help people overcome some of the terrible effects of war, including PTSD. And I thought to myself, when I saw that clinic, I said, wow, this is really neat that they're doing all these great things. And I love hands-on, and I wanted to just be part of something that was going to make somebody's life better. Not necessarily like a medical physician, curing something, but just being able to engage with someone on a level that provided more life for them and engagement. And so that's where I first got my start. And I was 16 at that time. And in the meantime, my father decided we needed to move to Pennsylvania. So I did get my education in Pennsylvania. So I've lived here, most of my adult life, almost 40 years, more than 40 years rather. And the reason I got interested in low vision, I have multiple family members that have had different challenges. I have someone in my family that was blind, and that person actually was Liberace's piano tuner. So I thought that engagement,
wow.
yeah, and early in my life, I got to meet this phenomenal, my mother's relative, phenomenal person that was just doing great things, had music, and I was very impressed as a young child. Like that was really cool to me. And then moving forward in my life, I have a couple other people that were very, very close to me. For all of those in Pittsburgh, this is a great story. The one person was a U.S. steel worker, and for many, many years, actually was there during World War II and so on, and retired in the 70s. But that person ended up starting to have visual problems. And I thought, well, I'm in the car driving in the back seat, and I hear, oh, I can't see the sign. I can't see I don't know if someone's coming, and I'm getting a little nervous. So at that time, I decided to bring this person to Pittsburgh, and I went to the eye center 30-some years ago. I'm thinking that it might have been Dr. Freiberg that we saw, but I'm not sure because it was a while back. But at that moment, I decided in my mind as a new OT, I said, I've got to get every education I can about vision impairment. And then that catapulted me into this opportunity at Jeannette Hospital, which is unfortunately no longer there in Westmoreland County. I actually started to work with the ophthalmologist and an optometrist and my rehab director to start one of the very first low vision clinics in a hospital-based setting. And that was in the early 90s. the cool thing about that was that I actually reached out to Mary Warren, who at that time just started to do a bunch of stuff in OT for low vision, and Dr. Eleanor Fay, which for those people that are in vision rehab and have known about the Lighthouse in New York City, she was very, very essential and instrumental in bringing most other organizations to low vision, including occupational therapy. And I just pulled her name up recently, and I just realized that she passed away in January of this year. So she was 96. She stopped working at the Lighthouse when she was 90. So the reason that's important to me is I've always had this passion, and I wanted to learn as much as I could. I've gone to many, many places, and I called Mary Warren in the early 90s, and she actually invited me. It's a funny story. She invited me to her clinic in Kansas, and I said, well, I'm near Pittsburgh, so I think I'm going to go to New York City instead. And here she ended up being one of the gurus in low vision, and I went back to school, 5 years ago, and she was my teacher. So it's a full circle story. So I'm very blessed to have all that opportunity. So learning about vision has been paramount to me for my whole career. I'm very blessed to be able to take that on with occupational therapy. And it really is a good marriage, because occupational therapists look at every single thing you do every single day of your life. And most of it, 99% of it is vision related. And so as therapists, we have this great education about learning about body systems, about the physical, the psychological, the cognitive, and social effects of disease processes. And we know that 70% of the brain is made up of visual connections. So it just kind of lends itself to the fact that we are the great activity analyzers, and we look at everything in life and we say, okay, well, how are we going to fix that? How are we going to change how you can do things if you're not able to see well? So we adapt the environment, we adapt strategies, we adapt, the person's capacity. So I know I went a little bit off on a tangent, but that's,
No, that's
how I
okay.
got interested in low vision and OT.
No, that's okay. What a lot of great stuff. So tell us now, as relates to, what's going on in low vision. There's, it seems like there's, every time I talk to you or I talk to Dr. Smith, it seems like there's always something new, new devices, and some of the things, what's really making the field advance right now? What are you excited about for patients?
So I think right now, the most important thing that's happening is that the technology changing. I think that it's much more accessible to everyone. I think that we're looking at kind of a new generation of ways to help people, whether it's using Google Home, whether it's using Alexa, whether it's using an iOS device, and you're having the opportunity to have an application put on the device that actually can read to you. That's called an optical character recognizer. And so whenever that happens, you're actually taking that burden of vision for reading out of the picture, and you're actually giving someone, great opportunity for independence. So that to me is one great big thing that's happening. I think the other thing is that we're involved in some clinical trials right now. We work with Dr. Martel in a couple of different situations with Gensight and Pixium. We're looking at, from a biomechanical standpoint, we're looking at those kind of changes. But for us in OT, we're also looking at the functional outcome of what happens with those kind of things and how we can help people better manage their daily activities. The other thing is the Iris Vision device, which is, we're seeing a lot more head-mounted electronic devices coming on the market. And we're actually doing a study with one with the Iris Vision, which is really phenomenal, because it is a device that can be used on the head. You can't walk with it, but you can actually use it to be able to see, to read, to be able to see intermediate, where maybe you're looking across the table at someone, or being able to see out on the field, going to a theater, being able to see those kind of things distance-wise. So it's giving people a great opportunity to engage in their meaningful tasks and their occupations that they may have had to shut down or quit because of their vision impairment. So those are some of the things that we're seeing. I think the horizon is wide open, and I think it's going to be even better, because technology is going to grow as the baby boomer generation continues. It's going to be a big force to help people, because they want answers and they want to be able to engage. I think that's really important.
I certainly can see that. I've had the pleasure of being able to see you help some patients, and I can see that some of these devices really can change people's lives. And it doesn't seem like everybody knows enough about what you do. Is that the case? Is it something that you know, someone's losing their vision, they may not be looking for those answers, or is it that people aren't referred enough for low vision? What are the reasons for that would evolve around people maybe not knowing enough about what's available in to them in terms of these low vision answers?
So you bring up a great point, Lonnie. I think number one, if we look to the American Ophthalmology Association, they put out a video, I think it was in 2016. It was called Something You Can Do. And I think what their idea is absolutely tremendous. So being an OT, I've been very involved with PM&R, which is physical medicine and rehab, the model of medical model of rehabilitative services when a person like has a stroke or has a hip replacement. And I think what they're looking at with vision is they're looking at that same model and recognizing that early intervention is very, very vital and important. And for us in therapy, I would love to see an opportunity where the retinal doctors and you know all the other doctors that work in ophthalmology, corneal doctors if necessary, anyone who actually sees patients in you know the eye center who may have a patient that would benefit from even 1 or 2 sessions in occupational therapy, because we can actually look at lighting, we look at glare, we look at environmental adaptation, we look at technology. And we can even just for a few sessions be able to help someone change their life. And you're absolutely right. We are very, I don't want to say unnoticed. That's not a good way to think about it, but maybe people are not finding us. And I think
Mm-hmm.
that is my message to everyone, is to be able to realize that vision is so vitally important, and the quality of life that results from vision impairment, you know, that can be actually assisted from our services is very, very important. And I think in our facility, we're very blessed. We have great physicians. We have Dr. Smith, who gives us wonderful referrals. He works very closely with us. We're on his team. We have, you know, we have doctors Eller and Dr. Bonham, and we have Dr. Herrera, and we have Dr. Martel. We have great people. But outside of here, I think that the word is not necessarily yet on the street that what the functionality that we provide to patients. So I think that's one of the things that I really hope to help facilitate. And I've done that actually by doing some lecturing, even to physician assistant students and nursing students. And of course, physical therapists know a little bit more about us, but I think the general idea is to really make sure that the healthcare provider has an understanding of what vision impairment does to their patient and how important it is to get to them to the right services in the most timely fashion to keep their life going.
That's you know, I think you're spot on. I think that educating the professionals is probably, you know, should be an important part of what you do, I'm sure. So if you were looking back, you've must have, you know, been working with, you know, so many patients, you know, over the time span. I don't even want to try to guess what the number may be, but is there anything that you would tell us that you know really stands out as something where, you know, you could say that you're very proud and very, you know, happy about the outcome for a patient that you work with, and very proud of?
So that's a very good question. And I think for me, there's a couple situations that come to mind immediately. The first one is whenever we started using the Iris Vision device, and we had a patient and her son in the office. And when she put the device on and we explained her how to use it, and she was able to tune the device up to where she could see, she was actually able to see her son's face for the first time in probably 30 years.
Aw.
And it's the heartwarming feeling that you get as a clinician. You know, we definitely maintain our composure, but it's really, really vital to understand the gravity of, you know, vision loss and
Mm.
how important it can change someone's life. You know, how it manifests itself in different situations. And just the idea of the social interaction of loss of ability to see someone's face, I mean, that was
Mhm.
huge to her.
Aw, yeah.
And the other one I think that's fascinating to me is technology has no age barrier. I have a beautiful woman that was in the office very recently who's 99 years old, And we were talking about technology, and she said, "Oh, I use my Google every day. I even have Google say happy birthday to me." And I showed her a little bit on the iPad, and she was really savvy. I'm like, this is really wonderful. So those are the things that are priceless to me. I've met some very, very wonderful people, and I have two wonderful teammates, that I want to acknowledge, Maria Shoemaker and Dana Arovich. We're doing wonderful things in the low vision clinic, and I really think that our opportunities to serve more people are just beginning to flourish, and I'm very happy and proud of that.
Wow. So there's a lot happening right now, in the department in ophthalmology. There's been a lot of growth. You mentioned even some of the physicians that you're working with who are new, kind of being added, and some of the plans, particularly around low vision. I know working closely with Dr. Sahel, it's something that's very important to him. What are some things that you can see, for the department that you feel will be important in the future and that you feel will be really helpful for patients that they're in the works?
So the first thing I want to acknowledge too is that working in the ophthalmology department at the Eye Center and working along with Dr. Sahal has been probably one of the most, um, I'm just so very proud to be part of the team, and I'm very blessed. I know Dr. Sahel is a very wonderful scientist and a very great humanitarian, and really takes to heart suggestions and recommendations. Early on, I had asked, if it was possible to get an iPad for the department, and he had no problem whatsoever helping me to get that, because he knows how important it is to help his patients, and our patients. And I think moving forward, number one, I want to thank UPMC, the collaborative effort we have along with, CRS, who Centers for Rehab Services for my company, which I'm very thankful for Dino Ravito, excuse me, and Dennis Martin, who are my supervisor and the CEO for the company right now, because their support of being able for us as clinicians to get certifications and to continue to be educated and promote our skill level and provide some of the best services in Pennsylvania for therapy. It's very, very important to us. And it's very important that we have this great collaboration with UPMC and with Pitt. I talk frequently to the occupational therapy department at Pitt with Dr. Skidmore and Dr. Baird and Dr. Toto. So we have this ongoing relationship. So I think for the future, we're very well poised to continue to perhaps even become one of the best service delivery models in Pennsylvania for this type of rehabilitative services. And I think once the building is done and we're actually able to integrate even more with vision, not only low vision, but vision impairment related to a neurological basis, such as stroke and such as MS and Parkinson's, we're going to have a great team there where we're going to have not only a clinic, but an apartment. We're also going to be able to work closely with physical therapists and speech therapists to try to actually bring this full circle into the whole realm of the necessity to meet the patient's needs right then and there. So I think it's going to be great. And we're also going to grow this telemedicine idea. As I was mentioning earlier, Dana Arovich and I worked together to write a grant proposal when the Beckwith Institute came out with the COVID-19 grant. And we were very lucky to get that. So we're doing a program where we're going to do telemedicine. The patient will be seen in the department, and then they'll go home with an iPad device, and we'll work with them remotely so that we can actually enhance the service delivery model for folks that might not be able to come in.
That's fantastic. I know that COVID's affected, so many people, and I do know and am aware that a lot of our patients with, vision issues or who've had their treatment interrupted because of COVID, or who may have lost more vision. And of course, if you're dealing with the problems that you have with low vision and you can't get in, or you're afraid to get in, it just increases the barriers in particularly in populations where the barriers were already there to begin with. So that's wonderful that you applied for that, and that you're helping people that way. So, well, thank you for all of this. This is very educational, but also, very enlightening and very inspiring in terms of what, I think we can look forward to for patients. Because as we said before, I mean, it may be some time before we can fix some of these problems, but there's help today, just right here in looking at what people can benefit from in technology and use of your skills in occupational therapy that you're providing to patients with low vision. Thank you so much, and thanks for helping all of the patients that you've helped. Um, we'll look forward to more, but thank you for coming and spending some time with us and doing this interview today.
Well, thank you very much. And I think the most important message is no matter what, there's always something that can be done to help someone who suffers from vision impairment or vision loss. And we're absolutely happy to be that part of the team. And we thank everybody at UPMC Eye Center. Thank you.